This is the checkpoint. This is.
Hi, how are you? There's only one day.
Yeah, you did for two.
You think she's going to have two? It's one. Let's hope it's one. One's enough trouble.
Yeah. I want twins from her.
I think it's good also.
Yes, one.
If it gives me two, I can accept.
Yes. But Joanne, you've had a scan. Have you had a scan?
Not yet. But very soon, next month, I'll go for it.
Well, that'll be fun. We'll be praying for you.
Okay.
That's just one thing. Yeah.
Yes.
One at a time, Henry. One at a time.
Too high risk.
Yeah. I think with twins, it's more risky, isn't it?
It's more risky, but yeah, I was praying. I watched
It's not up to him, is it? No.
She also married.
Yeah.
married. Question doesn't allow me to marry. I must finish my studies then. Everything, settle everything. Then I think of babies. Yeah, because maybe I'm still a baby.
How old are you?
They are
25. Yeah, he's still young.
He's still
He's
young.
still young.
If I think,
There's no need to rush.
No.
No.
No need to rush.
No.
Oh, what's wrong?
BNF. And the blood pressure, you've got a SFIG. Have you got a SFIG?
yeah, we have one.
One. And is that a mercury one?
It's a natural one, but this feeding on one.
Yeah.
It's not this one they put on the table. You know, there is this one which
You have the battery ones.
Namuwongo Community Medical Service is under an NGO called Namuwongo Community Foundation. Namuwongo Community Medical Service started last year, and we are about to make 1 year. The services that we provide us with clinical medicine, like the major non-communicable diseases, mostly the diseases that mostly affect our people, our population, especially as I've said, the non-communicable ones, the malarias, the typhoid, those ones basically concerned with sanitation. So we normally serve those people of the community because that's our target. But at times, once in a while, we also get those people from higher grade, that one who can really pay for the service, and they really also come in, but on a few occasions. Most of the people that we serve, especially the children of our foundation, we do serve them basically. That's the major pressure that we are targeting, plus also the people down there in the slums. So it has been a good beginning, though with some challenges, because these people sometimes, when they look at us, especially, they need that trust. And most of them, when they come here, because of the times when they just seeing the environment, they think that here is it's an expensive stuff. So at times when they come and then they get a free service, or at times when they pay that limited cost, they catch it to their surprise, like, even like you have been like fearing to come, because when you look at you people, you look to be expensive, but we are still digging to them, we're still telling them that we are very close for you. So don't be afraid, don't be there to fear to come, and we really serve you. So it's a great honor for me to be part of this family, and I know that journey is still long, and I believe that we are going to serve our community, because that's our target. We want to change our community, we want to change their lives, so that because health is a really need of their lives, and we want to change the people so that they come to be a better Uganda, and come to be a better future. That's our target.
Well, as you say, this is my first trip to Uganda, and my first trip to the project, and we set out by visiting the community itself, so I got to see firsthand the real need for medical care. And the wonderful thing is that, you know, we're right next to the slums, so it's easily accessible. And then we have the wonderful services of Dr. Henry, who is very approachable, and the patients warm to him. So it's lovely that they feel that they can come and get the necessary treatment, and if need be, and if it can't be provided here, then they can be referred on. I've also been able to see that the government services have linked in as well this week, and there was COVID vaccinations going on, there was blood donation, and then of course in the clinic itself there's a pharmacy which looks well stocked, and then there's the nurses room where they do the testing, so can test for malaria, for HIV, and also for stomach ulcers. So for me it's been lovely to see, you know, the clinic in action really, and I can see that it does make a difference.
So I first visited the new facility in February this year. That was my first visit here, and I was very impressed to finally meet Dr. Henry. And I think this facility is very well staffed, got some lovely nurses, and Dr. Henry is very approachable, and I've seen him treat a lot of people in the community, and I just really hope and pray that that message is really getting down into the community now, that they can come here, they can receive free medical treatment, and also, you know, for other people who don't live in the community but live further up, they can also come, but they will have a small charge for any services and medication provided. But that money is then put to really good use in helping those less fortunate. So if we could forge more of a partnership with the people that can afford to come and pay for some of the services, that will help us even more to serve the community of Namuwongo itself. So it's lovely to see the progress that Dr. Henry's made in such a short space of time, and it was really good to be here whilst the government and hospital staff were here, delivering the COVID vaccinations, the blood donations, and the additional screening services during this past week. So community, use Namuwongo medical services, it's there for you. Start to come and use it properly. I think it will have a really big impact on general health and well-being for people down in the slum community.